Hello, I'm Dr. Sandra Milam, and today we're going to be talking about If Not Me, Then Who? Um, about 18 months ago, we were asked to do a series called If Not Me, Then Who? Then lately, we've been asked to do something that involves the medical profession and how to deal with patients and different things from the medical perspective. If not me, then who? And so we're going to cover a few things just to lay in the foundation. My coworker, and Dr. Angela Sinyard, and I will be discussing a few things, and we hope that these will provide some insight. Well, one of the things we want to talk about is how to deal with the public. We know that in the medical profession, with the COVID restrictions and all the other things, there's certain protocols now that are in place that haven't always been in place. And so when you deal with the public, you have to remember they're not always mindful of these things. Anymore. They don't carry masks with them, so just have have mask available so that when they enter your medical facility, that they will use them. They don't always want to use them because they feel some of them have claustrophobic conditions and they feel like they're being hemmed in and they can't breathe, so they may be a little bit resistant. So don't you get resentful. We know that there's a certain amount of paperwork that has to be filled out, and them or the caregiver will be filling that out, but be compassionate with them. Don't just hand them a sheet of paper and tell them to fill it out, because they may not be thinking clearly or able to fill out that paperwork right then. I know that you have to have it for insurance information, but just be mindful of that. That they're not at their best and they may be a little resistant, or they may not can even fill it out because of particular situations. Also, when you talk to a patient, give them the dignity and the respect they deserve, because they are not feeling well, they're not at their best, and they're not going to remember everything that you tell them. Sometimes with the medication, they may not understand clearly what you are talking about, so they may ask questions. They're not asking questions to challenge your authority, they're asking questions for clarity. They're not going to remember everything you tell them when you give them instructions for aftercare, so make sure it's printed on a piece of paper that covers you and them as well, and provide a phone number in case they have to ask questions. Also, in certain cultures, they're not going to ask you questions because certain cultures are taught not to ask questions, not to challenge authority, not to ask a whole lot of questions. Also, when you're talking to our caregivers, you talk to everybody in the room. When you don't stand over them, just have a seat and sit there and talk to them casually, and tell them what you need to tell them. For instance, my husband's doctor, when they told him he was going to have an operation for colon cancer, she was concise, but she was friendly. And she told him what all was going to have to be done. Of course, later on, she called us back to see if we had any questions, because after you deliver the news, later on, the person may come to themselves and have more questions than what that you think that they'll have at the time. So provide a phone number, provide information, be accessible and approachable, because some people are intimidated by doctors and they have what they call the white coat syndrome. You notice when you take their vitals and they're going to the doctor, their blood pressure goes up. So just remember those things when you're dealing with the public. Older people don't understand. They think the doctors have the final say. Younger people may want a second opinion. So it's not challenging your authority. It's just wanting to find out all the information that they can about the particular situation. Also, be gentle. There's no cause to be rude. I know you're overworked and taxed to beyond what you're able to, but don't be rude to them, because you wouldn't want anybody being rude to your loved ones. Treat everybody the way you'd want to be treated. Remember, the medical profession is not just a high-paying profession, but it is also a calling. And you want to, as I said, you want to live by the golden rule and treat people the way you want to be treated. Just some reminders for If Not Me, Then Who? From Dr. Sandra Milam. Thank you for listening.